Hi, I'm Dr. Raveesh Sunkara. I'm a neurosurgeon at Arete Hospitals. Let's talk about trigeminal neuralgia. Trigeminal neuralgia or tic douloureux is a chronic pain condition that affects the trigeminal nerve, which is the main sensory nerve of the face. It is characterized by sudden, extreme, burning or shock-like pain which can last from 2 seconds to 2 minutes per episode. These episodes can come as short spurts or can last up to episodes lasting for 2 hours. Most of the patients in Indian scenario complain of pain around the mouth region. But you have to understand that trigeminal nerve is divided into 3 branches, that is ophthalmic, maxillary and mandibular. And this is the reason that whenever one of these nerves is compressed, the symptoms occur in the distribution of that particular nerve. Usually, the most common distribution the patients complain of pain is that of maxillary or mandibular division. Now let's talk about symptoms of trigeminal neuralgia. Usually, there is a triggering factor before this pain occurs. The triggering factors could be as simple as chewing or when there is a sudden gush of air on the face. Sometimes this pain also comes when you are talking or when you are brushing your teeth in the morning. Typically in Indian scenario, most of the patients visit a dentist thinking some issue with their teeth. The pain is typically felt in one side of the jaw, but rarely sometimes some individuals complain of pain in both sides. The pain can be completely incapacitating and sometimes the patient avoid eating to an extent that they'll start losing weight drastically. Causes of trigeminal neuralgia. The exact reason for trigeminal neuralgia is still under debate, but the most widely accepted hypothesis is that there is a blood vessel that compresses the region of the trigeminal nerve inside the brain, which on pulsating causes this shock-like sensation. Other possibilities of trigeminal neuralgia include multiple sclerosis or a tumor that is pressing the trigeminal nerve inside the brain. Sometimes the pain also happens following a facial trauma, and in some cases there is no obvious cause that can be determined. Let's talk about treatment options of trigeminal neuralgia. Always, the first option for trigeminal neuralgia is medical management. Typically, we start the patient on muscle relaxants and anticonvulsants, which act as pain-relieving medications. Second line of treatment includes Botox injections. Only when medical management completely fails in relieving the patient of symptoms is when we think of definitive options like radioablation or surgery. Surgical options for trigeminal neuralgia include microvascular decompression. In this, typically there is an incision made behind the ear about 2 to 3 centimeters. We drill a small hole inside the skull and reach the trigeminal nerve under a microscope. The offending element, that is a blood vessel or a vein, is separated from this nerve and an artificial graft like PTFE graft is placed between the nerve and the blood vessel. This relieves the patient of the symptoms. This is typically a very simple and a safe surgery to perform. If you are experiencing facial pain in the description of trigeminal neuralgia, and if the pain is chronic and cannot be relieved by medications, kindly visit your nearest neurosurgeon who can help you with definitive treatment options. As you know, early diagnosis and prompt treatment can drastically improve your quality of life.